Hey nursing leaders, ever had a gut feeling that something wasn't right with a patient, even though they smiled and said they were fine? Sometimes that moment is the window we have to save a life. Today we're talking about suicide risk assessment, how to spot red flags, ask the hard questions, and intervene with clarity, care, and urgency. Suicide is a leading cause of death worldwide and often preventable with timely intervention. As nurses, we're in a unique position to identify patients at risk before a crisis escalates. Suicide can affect anyone, but high-risk groups include individuals with depression, bipolar disorder, PTSD, substance use disorders, LGBTQ+ youth, veterans, incarcerated individuals, those with chronic pain or terminal illness, history of trauma or abuse. Warning signs to watch for: talking about death, dying, or feeling hopeless, giving away belongings or saying goodbye, sudden calm after intense depression, withdrawing from loved ones, risky behavior or increased substance use. Expressions like, "I can't go on," "you'd be better off without me," or "what's the point?" Always take these seriously, even if the patient minimizes them. Use validated tools in all care settings. Columbia Suicide Severity Rating Scale, C-SSRS, PHQ 9. Item 9 directly addresses suicidal ideation. Safety protocol, structured assessment of risk and protective factors. Key assessment areas. Plan, do they have a method in mind? Means, do they have access? Intent, do they want to die or are they seeking escape? History, previous attempts increase risk. Ask directly, are you thinking of hurting yourself? Do you have a plan? Avoid vague language. Clarity shows care, not judgment. Ensure immediate safety. Remove harmful objects. Place on one observation if needed. Alert the crisis team or provider. Document objectively. Use exact quotes, observed behaviors, and assessment tool results. Avoid assumptions, stick to facts. Collaborate and communicate. Loop in behavioral health, social work, psychiatry. Notify the next shift and create a clear care plan. Offer support resources, hotlines, crisis centers, safety planning. Educate with empathy. Normalize that suicidal thoughts are a symptom, not a failure. Teach patients and families how to recognize warning signs and get help early. Bottom line, ask boldly, act swiftly, stay with them. You don't need the perfect words, you just need to ask, listen, and act. Suicide prevention starts with one courageous conversation. What's your go-to phrase when checking in on a patient's safety? Share in the comments. Your words might save a life. Like, subscribe, and follow for more crisis care education, because every moment of connection counts.